This little light of mine, I'm gonna let it shine. This little light of mine.
On a sunny day like today, it's easy to let your light shine. But it's during those cloudier days that a little music at the Selkirk Mental Health Centre can go a long way.
The special thing that I found with music is that it's a universal language that almost everybody understands.
Jason Short works with the Groups program at SMHC, where music plays an important part in connecting patients to each other and themselves. It's a connection that the Director of Artists in Healthcare understands well.
It's not clinical, it's easy to get your hands on some collage and tell a story.
Easy for the kids to do.
Art is a way to sort through all of our pieces, and a new piece of funding from Artists in Healthcare makes it possible with visual art, movement, and music. After facilitating a full-day workshop, Shirley Grierson took a walk through one of SMHC's wards and saw for herself what art therapy could do here.
To me, it looked like here's 10 patients and they're sitting around and they're enjoying the music. It doesn't seem exceptional, but staff are going, you know, those people wouldn't be communicating with each other. They wouldn't be in a group. They'd be isolated.
The new relationship between Artists in Healthcare and SMHC is an example of how the centre is reaching out and working in the community, both in Selkirk and the province as a whole.
It's important for us to have a positive relationship with the community so that they are receptive of us going out, and we've never really had a difficulty. People are very open to us coming and going, and especially within the city of Selkirk.
Lindy Stanford's patients are in the geriatric programs. Whether she's working with cognitive stimulation, anxiety issues, or social interaction, she uses art to bring out the person behind the mental illness.
One day we pulled out some really old country music, the Hank Williams, the Hank Snow, the Tex Ritter stuff, and we had one gentleman, he smiled and tapped his fingers all the way through the group, and we're ready to go, and we say, okay, you know, it's time for lunch now, we have to go back. And he gave me this wistful look and he says, some songs just make you feel like being left behind. And it just touched my heart. I went, oh.
Everyone has a different reason for coming to the Selkirk Mental Health Centre, but programs such as the one supported by art therapy are a way to think about mental health in a positive light.
But when you look at the whole person and you look at mental health, it's really important to focus on hope and focus on the good points of the person, not just the negative side of a mental illness.
The end goal is rehabilitation, but the first step is engagement.
We see people participating that we didn't think would participate in the music program, and that's really good to see, because that could be the start for them to start working in the other programs that they need to be successful.
And that means a move back into the community where their true light can really shine. For Go Winnipeg, I'm Kim Kasher.
Shine, let it shine.